The standards for physiotherapists. Introduction to the module. This module examines the evaluation methods that a physiotherapist will use to evaluate a client's well-being and levels of impairment. It also covers the fundamental registration requirements needed for the profession to be practiced in the UK. Topics to be covered. What do physiotherapists do? Learn how physiotherapy works. Standards for the physiotherapy profession in the UK. What do physiotherapists do? The first responsibility of a physiotherapist is to diagnose the client's condition and create a schedule plan for treatment designed to minimize pain and improve mobility. Ongoing communication with the client is essential in order to measure the progress and the appropriate levels of treatment. The practitioner is also expected to support and encourage the client to continue their treatment independently to understand future support if required. In this way, good physiotherapists can provide preventative measures and remedies for potential health issues in the future. They can also operate or specialize in all age ranges, from infants to pensioners. A physiotherapist will typically work in three main areas: orthopedics, neurology, and cardiorespiratory. The most common forms of orthopedic conditions are back and neck pain, sports injuries, repetitive strain injuries, carpal tunnel, tennis elbow, motor vehicle accidents, post-surgical rehabilitation, hip or knee replacement. Typical neurological conditions will include stroke, spinal cord injury, cerebral palsy, head injuries, Parkinson's, multiple sclerosis. The most debilitating forms of cardiorespiratory conditions will include asthma, bronchitis, emphysema, congestive cardiac failure, CCF, respiratory infections, for example, pneumonia, hypertension, peripheral vascular disease, heart attack, MI, heart or lung injury or surgery. In all areas and conditions, a physiotherapist will accurately assess the symptoms, diagnose the condition, and arrange individualized treatment for their client. In some cases, they may also directly synchronize their activities with medical or medicinal remedies. Learn how physiotherapy works. The practice of physiotherapy necessitates the use of multiple disciplines and anatomical knowledge to get muscles, joints, and organs working to the intended levels. A practitioner will invariably encounter clients of any age and work with them to restore full mobility and well-being. They may be engaged by individuals who are living with a congenital condition, stricken with a chronic or debilitating disease, recovering from major surgery, recuperating from severe injuries, becoming prone to age-related ailments, subject to neurological issues that affect movement or coordination. One notable fact about physiotherapy is that it is almost entirely free from medication aspects. The primary treatment involves accepting therapeutic exercise and activities, conjoined with a willingness by the client to adopt a significant role in their own healthcare. Physiotherapists will incorporate changes into a client's lifestyle that will have a direct and positive impact on their well-being. They can be depended on to provide ongoing treatment, advice, and support for anyone with long-term pain or mobility issues. As such, all physiotherapists are rightly considered essential members of any healthcare team should they be involved in the treatment of an individual via referral or private practice. Standards for the physiotherapy profession in the UK. To operate as a recognised physiotherapist or physical therapist in the UK, a practitioner must register with the Health and Care Professions Council, HCPC. It is illegal for a physiotherapist to run a practice without this registration. The HCPC regulates 15 health and care professions in the UK, with physiotherapy just being one of these disciplines. They have set the standards of proficiency expected for physiotherapists, which have evolved and developed over the years, with input from other professionals and experts. This is to protect public members from poor practices or fraud, and they will investigate all claims of such. To work specifically as a physiotherapy assistant, registration with the HCPC is not initially required. As long as you are working under a professional or in a practice that is HCPC registered, this is acceptable. Although there are no set entry requirements for physiotherapy assistants, employers can still ask for proof of education and experience, GCSEs for English or Maths, a BTEC, or other vocational healthcare qualifications. Most training will be on the job, but there will also be the opportunity to study for a diploma or certificate in healthcare support services. Become an associate member of the Chartered Society of Physiotherapy, CSP. Register with the HCPC whilst gaining experience. The HCPC has documented 15 standards that must be adhered to whilst practicing physiotherapy. Whilst physiotherapy assistants need not register directly with the HCPC, they must be aware of these standards and always endeavour to consistently meet their expectations. The HCPC states that all registered physical therapists must 1. Be able to practice both safely and effectively within their scope of practice. So, a physiotherapist must observe and be aware of their personal limits. Know when to engage other professionals. Manage resources and workloads appropriately. 2. Be able to practice within the ethical and legal boundaries of their profession. So, a physiotherapist must understand their legal and moral obligations to a client or patient. Know the standards required of them by the HCPC. Uphold the confidentiality and privacy of their clients, and respect their independence and dignity during treatment. Realize that relationships with all clients should be respectful and to be free from bias, even in cases of apparent incompatibility or conflict. Understand the current legislation and UK laws regarding their profession. Know the importance and significance of obtaining formal consent. Provide high standards of professional care. 3. Be able to show fitness to practice. So, a physiotherapist must know the importance of displaying high standards of professional conduct. Protect and maintain their own health and welfare. Perform continuous improvement and education in their role. 4. Be able to practice as an independent professional, exercising their own professional judgment. So, a physiotherapist must accurately evaluate all cases offered to them. Make formulated decisions in light of the information available. Display sound judgment and reasoning capabilities. Accept responsibility for their decisions and effects of the treatment. Know how to initiate and receive referrals. Freely participate in mentoring and coaching activities. 5. Be aware of the influence of culture, equality, and diversity on practice. So, a physiotherapist must know how to adapt their procedures to meet the expectations of clients. Prepare to take account of the spiritual, physical, social, and cultural beliefs of clients and communities. 6. Be able to practice in a non-discriminatory manner. So, a physiotherapist must engage and treat all clients with no elements of bias nor judgment shown towards them. 7. Understand the importance of and be able to maintain confidentiality. So, a physiotherapist must observe the correct levels of confidentiality at all times and respect the client's basic right to privacy. Know the limits of information governance and be acutely aware of the necessary sharing of health and social care details when appropriate. Understand the situations and circumstance needed where a client's information may need to be shared outside of the practice to protect others or members of the public. 8. Be able to communicate effectively. So, a physiotherapist must be capable of communicating, instructing, and advising others in a professional capacity and benefiting their clients. Speak and understand the English language to an internationally accepted standard. Adapt their communication techniques according to their clients' requirements, including age, ethnicity, and hearing abilities. Use alternative forms of communication if verbal or non-verbal forms are restricted for any reason. 9. Be able to work accordingly with others. So, a physiotherapist must own a reliable contact list and support network for advice and references. Know how important and significant it is to build and update a professional network continually. Understand the importance of cooperation and coordination when working as part of a remote multidisciplinary team. Agree on shared objectives, goals, and priorities when working closely with other professionals and the clients themselves. 10. Be able to maintain records appropriately. So, a physiotherapist must keep accurate and comprehensive records, and recognize their importance to UK laws and legislation. Know how to control and store data in accordance with the UK's policies on confidential and personal information. 11. Be able to reflect upon and review practice. So, a physiotherapist must realize the weakness and strengths of their practice and methods, and be prepared to improve continuously. Welcome and participate in any internal or external audits. 12. Be able to evidence the quality of their practice. So, a physiotherapist must produce records and required information during an audit or review. Continually request feedback from clients. Understand the importance of quality control. Keep accurate and relevant records. Welcome improvement plans and be prepared for them. Balance the needs for quality and economy within their practice. Ensure that improvement plans do not compromise the quality of service being given to clients and colleagues. 13. Understand the key concepts of the knowledge base relevant to their profession. So, a physiotherapist must know the roles and responsibilities of other healthcare professionals. Understand the importance of research and industry advances. Embody the positive qualities of leadership and endeavor to practice them consistently. Attain full knowledge of the biological and anatomical functions of the human body, along with an acute understanding of relevant disorders and dysfunctions. Appreciate the importance of assessment and intervention. Show undeniable expertise in the areas of biological, physical, clinical, and behavioral science. 14. Be able to draw on applicable skills and knowledge to inform practice. So, a physiotherapist must know the structure and roles of UK health and social care services. Perform evaluations and deliver appropriate physical therapy programs with the information available. Use their knowledge and accessible technology to assess conditions and disorders. Explain the cause and reasons for therapy programs satisfactorily with their clients. Set targets and goals that are realistically achievable by clients. Ensure programs will restore movement and functions accordingly. Know how to secure clients during complicated procedures safely. Perform personal research and update service technology as appropriate. 15. Understand the need to construct and maintain a safe practice environment. So, a physiotherapist must know how to ensure the safety and well-being of clients and colleagues. Display an acute knowledge of the correct handling and moving techniques. Understand all of the UK health and safety legislation that is relevant to their profession and work environment. Perform regular and accurate risk assessment exercises to eradicate potential safety hazards. Make PPE, personal protective equipment, freely available for use. Guarantee their work environment is a safe area for clients, visitors, and colleagues. Summary. This module has covered the following points. Physiotherapists need to be able to evaluate each client's level of mobility, strength, and endurance, leading to an accurate diagnosis. Physical therapy treatments will be continually reviewed and monitored by the therapist, with the client taking ownership of the activities. A physiotherapy program should use proven techniques to restore the full functions of muscles, joints, heart, and lungs. A practicing physiotherapist must be registered with the HCPC and supervise the training and activities of an assistant. The HCPC has issued 15 directives that ensure the proficiency and professionalism of registered physiotherapists.